It's Wednesday, January the 19th. Again, before I go any further, I surely want to, take time to thank everyone for all the well wishes, all the prayers, and everything. I remind everybody over and over that the first 2 or 3 days, couple days with this were not very good. I mean, that's just all there is to it. When you get a blazing headache and blood pressure way up and heart rate way up and temperature way up and a lot of congestion and a little bit of a cough and everything, all of a sudden, and you're surely over 65 and carrying some extra weight and everything else, you got a lot to think about and a lot to think about, that's not very good stuff. Now, as far as taking every precaution, I've surely done that, and I've surely been fully vaccinated and boosted and all that, and but yet, voila, you've got it. And so with that, like I said, the first couple of days were not very good. We got the antibodies, and I didn't see any immediate reaction to the antibodies, like, you get the antibodies in a few hours, you're just feeling much better. I did not have, have that feeling at all. But after a couple of days, it surely started getting better, and then it's moved along really well. I'm tickled to death to be back with you, and more than anything, I appreciate your prayers. I will never forget them, and I appreciate all the well wishes, and thank you again. We've lost another 41 West Virginians, and it's terrible beyond belief. That's just all there is to it. We've now lost 5,576 people. I ask for your prayers for all them and all their loved ones, because it's tragic. It's absolutely just tragic beyond belief. But we've got to go on. We can't stop. We can't just huddle up and be bubble wrapped or something like that. We've got to go on, and in some way, somehow, I think by the grace of God above, we're going to get through this, and I believe we're making headway. All the vaccines, I would encourage you beyond belief to get vaccinated, and whatever you do to get boosted, because I know without anybody telling me in any way, if I hadn't been vaccinated, I'd have been in the hospital for sure, and I'd have been in really tough shape, really, really tough shape. So, stack the deck in your favor. You got to get vaccinated, and you got to get boosted. I mean, that's all there is to it. And what are these vaccines really doing? They're buying us time. That's what they're doing. They're buying us time. Whether it be 6 months or 4 months or whatever it may be, and in that 6 months or 4 months, it gives our scientists and our medical professionals time to find a real solution to make this thing go away. So absolutely, get vaccinated and get boosted and everything, and give us the time. Give us the time to be able to be here with you like I am right now. Give us the time for our experts and our scientists to be able to solve this riddle, and they'll do it. They'll really do it. Think about this. The first death that I'm going to read you right now is a 38-year-old man that we lost from Clay County. It's tragic. This stuff is tough stuff. So please listen to me. The 5,536th death, like I said, is a 38-year-old male from Clay County. The 5,537th death, an 83-year-old female from Wood County. The 5,538th death, a 47-year-old female from Roane County. The 5,539th death, an 85-year-old male from Wood County. The 5,540th death, a 76-year-old male from Jefferson County. The 5,541st death, a 75-year-old male from Wood County. The 5,542nd death, a 63-year-old female from Jefferson County. The 5,543rd death, a 75-year-old male from Jefferson County. The 5,544th death, a 93-year-old female from Mason County. I always stop. I always just think, I think about my children. I think about this young lady. For the 5,545th death, a 30-year-old female from Summers County. There's a good chance that I probably coached either against her or with her. Who knows? She may have even played on a ball team that I had at one time or another. It's terrible. The 5,546th death, a 74-year-old female from Cabell County. The 5,547th death, a 53-year-old male from Marshall County. The 5,548th death, a 54-year-old female from Harrison County. The 5,549th death, a 79-year-old male from McDowell County. The 5,550th death, a 71-year-old female from Ohio County. The 5,551st death, a 95-year-old female from Pocahontas County. The 5,552nd death, a 96-year-old female from Putnam County. The 5,553rd death, a 90-year-old male from Monongalia County. The 5,554th death, a 75-year-old female from Cabell County. The 5,555th death, an 88-year-old male from Monongalia County. The 5,556th death, a 51-year-old female from Tucker County. The 5,557th death, a 62-year-old male from Hancock County. The 5,558th death, a 66-year-old male from Raleigh County. The 5,559th death, an 82-year-old female from Logan County. The 5,560th death, a 70-year-old female from Brooke County. The 5,561st death, a 46-year-old male from Hancock County. I'll do that again. The 5,561st death, a 46-year-old male from Hancock County. The 5,562nd death, a 79-year-old male from Cabell County. The 5,563rd death, a 66-year-old male from Mercer County. The 5,564th death, a 77-year-old female from Mercer County. The 5,565th death, an 80-year-old male from Cabell County. The 5,566th death, a 77-year-old male. The 5,566th death, a 75-year-old male from Berkeley County. The 5,567th death, a 67-year-old male from Cabell County. The 5,568th death, a 57-year-old female from Raleigh County. I want to back up here and make sure I got this exactly right. The 5,566th death is a 75-year-old male from Berkeley County. The 5,569th death is an 80-year-old male from Harrison County. The 5,570th death is a 67-year-old female from Mercer County. The 5,571st death is an 85-year-old male from Cabell County. The 5,572nd death, a 94-year-old female from Cabell County. The 5,573rd death, a 90-year-old male from Berkeley County. The 5,574th death, a 64-year-old female from Raleigh County. The 5,575th death, an 86-year-old female from Berkeley County. The 5,576th death, a 78-year-old female from Jefferson County. Right here on the bottom of my notes, it clearly says there's 89.5% of the deaths in West Virginia have been unvaccinated people. Stack the deck in your favor, West Virginia. The active cases are 15,906 in West Virginia today, with 3,606 new positive cases. The daily positivity rate is 22.67. Our cumulative positive is 7.4. We got 374,000, right at 375,000 people in West Virginia that have recovered. We have 915 now in the hospital. 215 in the ICU units and 125 on ventilators. It's not good. Not good. The Omicron numbers, are still growing, and I would probably, I would tell you from the standpoint of everything that I know, all the sequencing, everything that's been done on what I had was Omicron. School numbers, there's 27 outbreaks in 16 counties. The DHHR is going to give you a bunch of map updates. I'm sure Secretary Crouch is going to give you that, or our team is going to give you that in a few moments. The Biden administration just announced that they are sending every household in America 4 free at-home COVID tests, and you can get them by looking at our website at COVID test, DOTGOV, COVIDtest.gov. Okay, and they're available starting today. The National Guard's doing all kinds of great work. We know that they're backing up our hospitals to make sure that our hospitals are fully operational, and we commend them. And in just a few moments, unless Jordan, are we doing this now? With Adjutant General Bill Crane, is he doing that now?
He can if you'd like him to, sir.
Well, maybe we ought to. General, please come in.
How you doing, Governor?
I'm good, sir. How you doing?
I'm good. Hey, just real quick, so at the Governor's direction, we quickly established a plan to support our West Virginia healthcare systems by augmenting them with service members from the National Guard, much needed assistance for our frontline workers in the hospitals. As of today, we've received about 15 requests for support across the state from our hospitals. We've been working that with the GIADF and as well as the Healthcare Association. I've been talking to General Hoyer as well as Jim Kaufman with the Healthcare Association to make sure that we're meeting all the needs. And at this point in time, we have plenty of folks trained up to meet the requirements now. As we move into CAMC, that begins today. I have about 180 other folks going to Camp Dawson. They're already moving to get ahead of the weather. We will have them trained up by the end of the 23rd of January. And so those folks will be available. And once we have them trained up, all of the requests that we have so far from all the hospitals, we'll be able to meet all of those needs. And again, at the Governor's direction, we will continue to work to train additional folks, getting up to the 350 service members trained up for this mission. As we continue to do additional missions as well, such as delivering of vaccinations and personal protective equipment, testing, vaccinations, and supporting our local health departments. And so with that, sir, I'll turn it back over to you.
Yes, sir, Major General. Thank you, sir, so much. Okay, just reminders again, and I'm living proof to that, if you're 65 and older and you have any symptoms whatsoever, you ought to get tested. The antibodies could very well save your life. I am a living testimony to that also. I encourage you, if you're going into a crowd of people and you don't know, who a lot of the folks around you and everything, you're 65 and older and you have any compromising issues whatsoever, you ought to probably wear a mask. From the standpoint of mandates and everything else, like I said, I am standing as strong as I possibly can. I always am. I stand for our freedoms. I do not think we should be mandating, one another on what we should be doing. We're going to have to find a way to live with this, but at the same time, I encourage you with all in me. The vaccines work, the vaccines are safe, the booster is really important, and with all that, if you get that, you are stacking the deck in your favor, and you're helping us all across the board. You're helping us to not get overloaded at our hospitals. You're helping the National Guard because these folks work so hard, and now they're having to back up our hospitals and everything. You're helping us in lots and lots of ways. So just think about it and everything, and if you choose to do so, that's great. And if you don't, we're going to be very respectful, and we're going to stand rock solid behind your decision too. From the standpoint of, let me think here. I think I've covered all the booster stuff. Just some more, statistics or math and everything. We are at 70.5% of all those that are 18 and older that have gotten one dose, 82.1 on the 50 and olders, and 89.5 on the 65 and olders. You've got all that on our website. I encourage and ask our parents to help us with the younger people and everything. Young kids and everything think they're invincible. They always do. and everything, but they can get this. It can cause some significant long-term maybe side effects that we really don't know exactly everything that it can cause, but we sure don't want our kids to have it just for the sake of having it and everything. So if we can get them across the finish line and get them vaccinated, that helps all of us too. You know, all the information on the COVID-19 vaccine info line's up. I encourage you take advantage of all the free testing. I appreciate the Biden administration sending the home kits to, that's going out at no expense to anyone, and that's really good. I always thank Fruth and Walgreens for all that they've done all through this, and I report to you now that we have 133 outbreaks in our long-term care facilities. That's a bundle. That's an awful lot, an awful lot. We got to really, really watch because, these folks really depend on us, really, really depend on us to be doing the right stuff and pushing the right buttons. And they know just how at risk they are. And so as they depend on us, we got to really do all we can to protect them. We have 2 outbreaks in our church communities in 2 counties. That's Webster and Kanawha County. With 310 inmates now, it's jumped way, way up, hasn't it? 167 staff cases. We have to protect those folks as well. They depend on us too. From the standpoint of getting your flu shot, I highly recommend you do that. You can do it at the same time you're getting your COVID shots. I tell everybody over and over about if you're a renter or your landlord and everything, you got to call us. I mean, we've got these dollars and everything. We can send dollars your way and everything. If we can get you qualified, it's just more dollars that we put right into our system, and the multiplier effect of those dollars helps us. I encourage everybody about giving blood. Really, really, really important. Now, today is Tourism Day in West Virginia, and I'm going to delay my last announcement to the last one, and I'll tell you in just a second, but today is Tourism Day. Now, think about this. When I walked in the door, I said over and over, we got to diversify. There's no question. We can't just depend wholeheartedly on coal and gas and oil. We can't just do that wholeheartedly. We have diversified. We've diversified in lots and lots of different directions. One of them that is really significant is tourism. I said right off the get-go, and any frog that's not proud of his own pond is not much of a frog. Really, if you just think about it, just think about that just a second. And when it really boils right down to it, if we're not really, really proud to show ourselves off in West Virginia, then we're not much of a frog. Because absolutely, with all in us, we have the most beautiful state and the greatest people on the planet. So we started down a path. We started with a little young lady and everything that had a lot of energy and was just fired up out of her mind. Chelsea Ruby. Today she's Secretary Ruby. And absolutely the job that she's done is unflat believable. On both floors of the Capitol right now, all over the Capitol, there's all kinds of people showing their wares and showing, all the great stuff about tourism, because today is Tourism Day here at the Capitol. Just think about these numbers just real fast. $611 million, over $500 million we have grown in traveler spending in West Virginia, since we walked in the door. Think about that. 14.8% increase over and over. Every travel guide is saying West Virginia is the place that people want to come to. West Virginia is the best destination. West Virginia, can you imagine? All we did is we absolutely put our money where our mouth is. We absolutely put funds in it, and we started promoting us. We knew how good we were, but then we started telling the world how good we were. And before you know it, they saw the beauty too. It doesn't take long. It's really contagious. And so with all that, I congratulate all the folks all the folks under Secretary Ruby and all the folks that are involved in tourism all across the state in every way. I thank them beyond belief. We are absolutely just knocking it out of the park with tourism beyond anybody's imagination. And you know what? There's tons more to do. There's tons more that can come. Right now, in all honesty, we are just getting the parsley around the outsides of the plate. The meat and potatoes are still there, and it is astronomical, the potential growth that we can have in West Virginia in this great, great industry. So I congratulate all of you and everything, and thanks so much. Now, my last announcement. And this was tough in a bunch of ways, because this is just how much I think of this man. Steve McDaniel is retiring from his position as the head of the DNR. Now, you talk about a man that is absolutely, that we have just bingoed off one another like crazy. You know, of course, you know I love the outdoors and I love nature beyond belief, and I love our waters and our mountains and everything, and I have experienced that over and over and over. Now, Steve McDaniel shares in the same love that I share. And Steve McDaniel came into this position and everything, not a bureaucrat. Steve McDaniel came into this position wanting to really do something. And what he's done at the DNR we will remember for decades, if not centuries to come. Absolutely, this man has done a fabulous job. Over and over, he's come to me with ideas and everything, and I've tried to do every single thing that he's come to me with, and then I've tried to add an idea or two in it also. But absolutely, I commend him and his efforts beyond belief. I'm going to miss him from the standpoint of, heading up the DNR, but he has agreed. He has agreed to stay on in a different type of capacity as an advisor. And absolutely, we will use his wisdom for as long as he wants to stay. He has been a superstar beyond all comprehension. We have spent $151 million on our state parks, on upgrades to our state parks, and now you can't hardly get into the state park. It is unflat believable to just think. Now think about this. We have also added 85,896 acres to the state, to the state war chest, from the standpoint of making those acres available to our hunters, our fishermen, absolutely all those that are enjoying the outdoors. It is unbelievable. We changed how we stock trout. We just didn't roll up in one spot, throw all the fish in one hole, and not to say we just did that, but now we stock trout differently. So people can enjoy those trout and come and know they have a chance of catching fish and enjoy our streams. In addition to that, we even stock trout now on Saturdays. We have added so many different streams. We just added the Guyandotte River, and the Guyandotte is a beautiful, beautiful river, with cooler waters and a trout habitat like crazy right now. So with all that, I congratulate this man. I thank him from the bottom of my heart. He came along in 2017, and we'll miss him in that capacity, but we'll celebrate the fact that he'll be here and be an advisor and be helping us and still be a part of our team. So Steve, great job, great job. I know you want to spend more time with your family, and it's very deserved. So enjoy your family and don't run off too far. And again, I thank you from the very, very bottom of my heart in every way. That's all I got right now.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Good afternoon, and support and re-emphasis of what the governor has said to us. We know that West Virginia now is a state, like most other states in our country, where the Omicron variant of COVID-19 is the dominant one. And if we look at yesterday from a statistics standpoint, the US reported 1.12 million cases of COVID-19. And that is over a third of the world's reported cases yesterday, which was a bit over 3 million. We had almost 3,000 deaths recorded yesterday related to COVID-19, more than a third of all the world deaths. A modeling project at Penn State University that works closely with the White House has estimated at the current rate of vaccinations and boost, we can anticipate seeing somewhere between 60,000 and 300,000 new deaths in the United States. And we just passed 850,000 deaths in our country. So we have an opportunity here to double down, as the governor would say, pull the rope in the same direction, run to the fire, and make sure that we are getting vaccinated and boosted appropriately. That includes younger children. We know that there are more people in American hospitals today than ever before in the pandemic, as well as more children in American hospitals today than any other time in the pandemic. We know in a recent study that came out in the New England Journal of Medicine that if you were unvaccinated and a child, that accounted in a survey of 21 states' hospitalization records for children, that 98% of the kids that end up in the hospital are unvaccinated. And this is now looking at teenagers, 12 to 18-year-olds. And also of those children hospitalized, 40% were in the ICU and 29% were on a ventilator. And if we look across the world, in Israel, say for instance, then everybody who needed the highest level of life support, the ECMO device, the bedside cardiopulmonary bypass, everybody in their country who is on an ECMO machine is unvaccinated. So we know that, you know, despite some of the narrative being that Omicron is less severe, it infects a lot more people. Remember, our greatest number of cases in a single day, 303,000 before Omicron. Now we've averaged about 800,000 cases a day per day for the last week. So this is a different level of infectiousness. And that's the reason why it's so important to be vaccinated. Now, some people might say, well, if Omicron can infect people who've been vaccinated previously, what's the big deal? Why should we get vaccinated? And it is really important to understand that the benefit of vaccination for COVID-19, as well as for most every other infectious disease, including influenza, is not only to try to reduce the spread, but it's most importantly to reduce the severity of the symptoms. And what we're really worried about is the loss of lives in our most vulnerable population who may become infected with COVID-19 from others, which is why as many people that can be vaccinated, including eligible children, it becomes really critical to protect them and to protect our most vulnerable. But also that if you get COVID-19, the relative reduction in risk of hospitalization is about 31 times less for our older part of our population. So really important to do that. And the monoclonal antibodies are not a substitute for vaccination. Neither are the pills, neither are other therapies that we have. They're an ancillary. They work with the vaccinations to try to give even more protection, like the governor receiving the monoclonal antibodies. But we know that the COVID pandemic is not over in our country yet. The case numbers are soaring high. The hospitalizations are soaring. Our hospitalizations are up to 915 West Virginians in hospital beds, and we are likely going to see a continued increase over the next several weeks, and the deaths will follow as another lagging part of this process. So the time is now to get vaccinated, to get boosted, to protect yourself, to upgrade to a good mask. The federal government is going to make N95 level masks available to Americans. They plan to ship out 450 million of those. And just, I think on the 19th is starting the ability to go through the Postal Service and order a free at-home test from the federal government. So many tools are available, but we really, really encourage people to take advantage of those tools, get fully vaccinated, get boosted, protect yourself, protect West Virginia, And that's the way we best make it through this pandemic without more loss of life and without surge on our precious hospital capacity and healthcare capacity that we have now. Thank you.
Thank you, Doctor. Next, we'll go to Dr. Ainam Jadar, State Health Officer.
Good afternoon. I just want to remind everyone, Clay and the governor mentioned about the at-home test that can be ordered from the federal government. If you get an at-home test and you're not going out and getting tested, there are ways to keep yourself safe from COVID-19. Those tests are accurate and we use them for assisting patients. But if you test at home and you're COVID positive, we do ask that you go ahead and self-isolate, contact any close contacts that you've had, and that would be anyone 2 days prior to any symptoms or 2 days prior to you testing yourself. But there are is more information on our dashboard as well for that. But just to keep that in mind, that if you do find that out at home, to go ahead and take care of yourself and contact your doctor as needed. Thanks, Jordan.
All right, thank you, Doctor. And finally, we'll go to Secretary Bill Crouch with the DHHR.
Good afternoon, everyone. As the governor mentioned, the map is back up on the dashboard. During the time that the map was down, we've consulted with stakeholders. Our folks have worked hard to try to develop something that's meaningful for the folks in the community and the state. This is a result of changes that CDC has made in terms of active cases. But we've reviewed information from CDC and we looked at what other states are doing and we've tried to follow those guidelines as closely as possible. All counties are now on a 7-day average. That's probably the biggest change you will see on the map. We've adjusted our thresholds to align with CDC, but we've kept our gold color. So we have an additional level that CDC does not have. As with the previous map, individuals who are recovered, residing in nursing homes, state or federal prisons, and universities or college isolation dorms continue to be excluded from the map. These individuals are not, these individuals are isolated and no longer in the community to spread the disease. So they have been excluded all along, they'll continue to be excluded. So we will continue to push information out that is useful for the citizens of the state and attempt to be as transparent as possible, as always. Thank you.
Thank you, Secretary. We'll now go to questions from members of the media. The first today from Mark Curtis with Nexstar Media.
Good afternoon, Governor and cabinet members and fellow reporters. I'm happy to report that I had my 14th COVID test this morning over at the Kanawha Charleston Health Department. I just want to give a shout out to the team over there and Dr. Sherry Young. They have done a fabulous job through all of this. Getting to my question, I looked at the breakdown of the vaccinations, and I find the lowest rate of vaccination is children ages 5 through 11. Only 16% are vaccinated. Ages 12 to 15, 45% vaccinated. Those are the two lowest age groups of any demographic in this state. I asked because last week there were more than 1 million new pediatric cases in the United States. I'm wondering what the numbers are looking like here in West Virginia with pediatric cases, and what do we do to turn the situation around? So I'd like to hear from the governor and both Doctors Marsh and Amjad.
Well, Mark, first of all, you got about 6 more tests to go until you get my number and everything, because I think on the 20th is when this nailed me, but I hope and pray it doesn't get you. But anyway, and I thank you for your friendship. But Mark, I think the people that are better qualified to answer this question are, Dr. Marsh and General Hoyer. But I would say just this. We have pivoted so many different times. We went out with Baby Dog and really pivoted and went to our schools and we did a lot of work there. And I felt like that we really made some headway there. At the same time, we were having a crisis with the fact that our seniors weren't getting their booster shots. And so we pivoted back toward our seniors and everything. We still got some additional work to do there and everything to get to our senior centers and give them those awards and everything. But Mark, we continue to just move as quickly as we possibly can. And you're correct, and I go back to just this. A lot of folks are probably sitting on the sidelines, with their younger kids thinking this thing's going to pass or it's not going to be too bad or whatever it may be. and it doesn't really affect our kids in a really negative way. And we absolutely still, you know, all of us, and I'm not being critical of this in any way, but everybody to some degree is a little bit afraid of the dark. And so we really, you know, have gotten so many conflicting, you know, opinions, you know, coming out of DC that it's got a lot of people scared, and a lot of people are really hesitant about the vaccines, especially giving those vaccines to our kids when they're incredibly safe, and, you know, to the best of all of our knowledge, they're incredibly safe. And but at the same time, you don't want to get your kids, you know, that have COVID and then awaken way down the trail and everything to issues that they may carry all their lives and everything. But on the other hand, I understand the concern, and so maybe and I've just seen this general, you know, is not available. But if nevertheless, if Dr. Marsh could follow up on what I'm saying and maybe give it a whole lot more clarity.
Thank you, Governor, and thank you, Mark. So we know that one of the differences in the Omicron variant versus any other form of COVID-19 is it seems to have a potential to be a more severe infection in non-vaccinated children. And what's important about this, as you said, is we see our lowest vaccination rates in the youngest part of our population. And as we've looked around the world and see that we've given 10 billion vaccines around the world and over 500 million in our country, we know that these vaccines are very safe, and very safe for children as well. Through the clinical trials using the Pfizer vaccine, which is the only one licensed for younger children, we've seen basically no evidence of really significant side effects other than local arm pain for a day or two. And this is so important because vaccinated children are very much also protected against severe consequences of COVID-19. And as we look at the age ranges that we need to really double down, it's in that 5 to 12-year-old age range where we do have vaccines available. And the vaccine manufacturers are working very hard on a 6-month to 5-year-old vaccine. The challenge there was that when the clinical trial data came to light, that children 2 to 5 didn't get the boost in their antibody levels using a microgram of the vaccine, as opposed to 10 micrograms in that 5 to 12-year-old range and 30 micrograms in the adult range. And so as we look at that, the Pfizer company working with the FDA has given an additional dose to see if that doesn't help. But as I understand it, the 6-month-old to 2-year-old group actually got a good boost from that 1 microgram dose. So I think soon you're going to see a vaccine available for 6-month-old to 5-year-olds. But in the meantime, really important to protect younger children, and really important to get the whole family vaccinated, because that's the way that you can protect everybody in the family, is having people's vaccines up to date. And when people are eligible to be boosted, 5 months now after their first series, and that's now available for 12 and over, that we really want to see them get boosted because of that loss of vaccine potency that we see after the 6-month time frame.
All right, thank you, Mark. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. I wanted to ask about the most recent update to the University of Washington's modeling. They're showing the state's hospital resource use to peak around February 4th or 5th. I was wondering if that is consistent with what we're seeing and predicting, and if that peak hospital resource, does that represent the peak of this Omicron wave? After that, the hospital resource are expected to exponentially go down. Thank you.
Dr. Marsh, I think you've got the answer, please.
Thank you, Governor. Thank you, Charles. Charles, we know all of these modeling predictions are merely that, and they're certainly, foiable to changes as we go forward. We do think that the Omicron spread, as far as new cases, will likely start to peak and plateau over the next, we believe, 5 to 14 days. And as we see the peak of the cases and that plateau, and the plateau, like we saw with Delta, will be a bit sharper, we think, because Omicron is generally more up and down, but that represents the spread to more rural parts of our state. So we have multiple curves underneath that plateau, we think. But when the plateau starts, we know that it still is 5 to 14 days after that we can see an increase in hospitalizations, and a week to maybe 2 to 3 weeks after that as we see an increase in deaths. So while the virus spread will start to crest first, the cases will crest second, the hospitalizations and the deaths are the last things to peak. So whether it's early February or not, we're certainly watching that. We're watching our RT value that's already starting to plateau some. And so we think that as we get more people measured with the virus, we will continue to hopefully see that start to plateau and come down first. But as the governor said at the beginning of the press conference today, our percent positive rate, I think yesterday, was over 22%, amazingly high. So we still see that Omicron is spreading in West Virginia, and we will watch, as well as everybody else does, to try to see where that peak goes. But we know that the more that we can reduce that peak and make it distributed over a longer period of time, which is how people taking good care of themselves, being vaccinated, wearing a mask, being careful right now, it will help reduce that surge on our hospital capacity, which is one of the things that we're the most worried about right now.
All right, thank you, Charles. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11. Thanks for taking the question. I want to expand on what General Hoyer said Monday when he quoted the former, I believe it was the Surgeon General, who talked about while the Omicron variant has been seen by many as less potent than Delta, there's much more of it. So when you have, say, more opponents shooting at you with lesser weapons, you still have a better chance of dying. At 1.3, I think, times chance is what he said. USA Today and other people are reporting that we're seeing expected deaths in the U.S. to increase because of the Omicron variant. And I wonder if Dr. Marsh has taken a look at West Virginia and if there is a corresponding increase that's predicted here, that because of Omicron's vast spread and its infectious rate, if you think our death rate will go up correspondingly to match what they believe the national death rate will be doing. Thank you.
Dr. Marsh. Kenny, thank you bunch.
Yeah, thank you, Governor. Thank you, Kenny. So Kenny, we are very worried about the surge to hospitals and then deaths that might follow that. And as we know that the sort of the order of things is the reproductive score of the virus, which should crest first, the number of new cases, which should crest second, the hospitalizations, which should crest third, the severity of the illness, including ICU and vents, which should crest next, and finally deaths, which should be the last thing to go up and down. And we certainly are very worried about the still really significant numbers of West Virginians who are eligible for vaccination who have not been vaccinated, and of those that have been vaccinated who have not been boosted, because the more current your immune response and function is, the more you're protected against the most severe consequences of this illness, including hospitalization, ICU admission, ventilator use, and death. So we do anticipate, as we see cases going up and see hospitalizations going up, so will the severity of some of these people's hospital stay, and we will see more deaths follow. The question is how many, and that is going to be determined by, one, how we help everybody decide to be vaccinated and or boosted if eligible, and number two, how careful people are about wearing a high quality face mask and doing the other things to try to reduce their exposure to people with COVID-19 in indoor environments. And remember, in South Africa, about 40% of the people with the Omicron variant were relatively asymptomatic. And from data from the NBA it looks like that the Omicron variant, while starting to reduce its spread at 5 days, still is potentially spreadable up to day 7 to 10. So it is also important that if you do have an infection, please wear your mask when you're around other people and try to encourage them to wear a mask, a high quality N95 KN95 mask to protect all of us in West Virginia during this really critical phase of the Omicron surge.
All right, thank you, Kenny. Next, we'll go to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, everyone. Governor, are you wearing an N95 mask? And if anyone is there that can address how many N95 masks that the state of West Virginia has in the stockpile, and if there has been a increase in demand for it since the recommendation of the CDC was upgraded here a couple days ago, according to Dr. Amjad. Thank you.
Paul, I'm absolutely wearing an N95 mask, and there's no one in here with me right now. And I take it off to be able to do this, but they got all the cameras set up and everything, and they all leave, and I take the mask off and do it. But I'm absolutely wearing an N95 mask, and I've got to do that. A few more days now and everything, but then I'll be tested multiple more times, but. General Hoyer could probably answer the question a whole lot better, than anyone on my staff. But maybe Dr. Amjad, if you could take a stab at the balance of the question. But Paul, thank you a bunch.
Yes, Governor. Paul, we normally keep like a 6-month supply of N95s, gowns, gloves, things like that. And I believe, and I'll have to double check the number, last time we checked, we had at least over 400,000 N95 masks. And then also the National Guard and WVU has been working on developing their own masks, the West Virginia masks that can also serve high quality use as well, but we can confirm those numbers and get those back to you.
Major General Crane, maybe do you have any information on that if you'd like to add anything?
Hey, sir, the update I have is that we are continuing to make the West Virginia mask. We're waiting on the steel die to come in for that, and that way we can manufacture as you directed us to do, to continue to make masks and have those available for use throughout the state of West Virginia. And we can always continue to look at our stockpiles down at the warehouse and work with DHHR to ensure that we do maintain those stockpiles.
All right, thank you, Paul. Governor, I'll turn it back to you.
Well, first of all, is Charles still with us? I mean, can you check and see if Charles is still with us?
I believe he is.
Okay. All right. Charles, I'm only teasing here and everything, but I'm envious in a lot of ways and everything. You started off growing this beard and everything, and it was smaller, and if I were, the reason I'm envious, if I were to start down that path, the first thing that's going to come out is going to be white, and then I'm going to look like Poppin' Fresh or something like that, to tell you the truth. But with all that being said, Charles, your beard grew and grew, and it got bigger and bigger and bigger and more impressive and more impressive. And I said, oh my God, if he lets this thing continue to grow, he's liable to turn into Cousin It. But nevertheless, Charles, I can see that you've gone the other way, and all I could think about in looking at you and that your red beard, it looks really great and everything, and I think about Chuck Norris. So maybe you're the second coming of Chuck Norris now and everything. But nevertheless, Charles, I love you to death, and I tease with you, and I welcome you to tease with me too. And the only other thing I would add is Dr. Marsh. I always listen to everything everybody's saying, and Dr. Marsh absolutely just said just a few minutes ago that from the standpoint of our children, you almost see no negative side effects other than maybe a little bit of a sore arm by taking the vaccines. From the standpoint of our children today, we know we've got a bunch of kids that are in the hospital today. From the standpoint of our children, here is the best expert that we can possibly have, the coronavirus czar, that is telling us, telling all of our parents, getting our kids vaccinated has a very, very minimal side effect. But absolutely having them not vaccinated, if they were to get this, it could be not great stuff. And I'm not trying to scare anybody at all. I'm just reporting exactly what the coronaviruses are. The person that is the smartest and most knowledgeable of anything to do with this virus, the guy that I called right off the get-go, you know, when I was in a tough spot, you know, the guy that I called right in the beginning, without any question that I have real confidence in, you know, he tells us he can't see where there's many adverse side effects from getting our kids vaccinated other than an occasional sore arm. But you can see, you know, bad things happen if our kids aren't vaccinated. He encouraged families to be completely vaccinated to protect themselves. I think we should listen. I think we should absolutely listen to the guy that we have put in the most important position in this virus, in this pandemic of anyone. Now, only other thing I'd leave you with is just this. We got a bunch of snow, and in West Virginia it's wintertime, and we should enjoy that snow. And I want to report one of our buddies that is really enjoying the snow, and that's Baby Dog. You know, in fact, she's learned a new trick, and because she'll lay and roll over and do everything in the world in the snow and loves it teetotally to death. And now she's gotten to where she likes to go through a drift and completely go, invisible and come out the other side. But now her new trick that she has really begun to really enjoy, because she loves cool or someone rubbing her belly, but she'll get up on the hill in the backyard and run. And for her, running is not terribly fast, I give you that. But she'll run, and then absolutely she'll just lay herself out just like that to where her belly's on the ground, and down through the snow she goes to where she completely goes under the snow, and out she comes on the other side. Now, she's having a big time with the snow. I hope our kids have had a good time and everything, and we want to be really careful on the highways and all that. But and I know we got a bunch of people that their power's off, and we're trying to get all that fixed and everything. But nevertheless, I wanted to just give you something to smile about and everything, because at the end of the day, I truly believe the good Lord gave us the ability to smile and to laugh, and that's what we should do. And the very last of my last, I've gotten so many cards, and I'll never forget it. I'll never, ever, ever forget it. But thank you so much. And, you know, I was just sitting here right here reading a card from Karen, and I think it's Descamp, and she sent me this beautiful card and everything. And she is from, now get this, I got to tell you this real quick, but she just moved here in September, she says, from upstate New York. And so she said, and she goes on to say that we have enjoyed moving here so much. Everyone is so friendly. What a wonderful place. Now, from the standpoint of Karen, we welcome you here, and we're glad you're here, and we hope you'll be here for the balance of your entire life. And this one really caught my eye and everything. This is a little Boston Terrier. Remember, we got Boston Terriers at the house. We've only got one now and everything, and they're in the bed with us every night. But this lady and everything sends this, and she's so wonderful that she sent it, and her name is, it's a delegate. This is a delegate, Sharon Spencer. But anyway, thank you so much, and thank you for putting that little Boston Terrier on the card and everything. So nevertheless, thank y'all again, and again, I'll never be able to thank you enough for all the well wishes and everything. And think about Baby Dog sliding down that hill in the snow. But anyway, nevertheless, thank all of you.